Welcome to another week, another hot Tuesday, another exciting edition of EME Podcast, baby. Woo, woo. Woo, woo. Hey, this the Mack and Energy, baby. This the Mack and I'm coming from Paris, France, representing the EME crew. We got Dirk McDirt, CEO, boss of all bosses. We got Caleb, King Caleb, the spiritual advisor, that straight up G. We got some beautiful, amazing guests this week. We also got Paul. We got Paul. He's somewhere around here. We got Paul somewhere around here. There you go, waving at everybody. Hey, Paul, how you doing? What's up, boss? What's up, Terminator? What's going on today?
Man, I'm doing great. I can't complain, man. It's been a good EME Tuesday, man. A Power Tuesday. I'm living. I'm staying positive. Keep putting in work. Keep doing what I'm supposed to do, man. Thanking God. And this is where I'm at. You know what I mean? So, yeah, I'm all right.
I mean, what's up with you, King Caleb? What's happening, Jack?
Man, it's a beautiful day to be in the land of the living. I'm blessed. That's what I'm gonna say. Hey, I'm blessed to be right here.
Hey, man. We got some guests. We got one guest on Zoom, and we got a guest in the studio. Would you beautiful ladies please introduce yourselves?
Go ahead, Pat.
I am Pat Griffin, and I am excited to be a part of this group tonight. I don't know how much you want me to share, but
as much as you want. I
am a psychologist here in Little Rock, and I've been around for a minute, but I am looking forward to hearing what this group has to say and being a part of the exciting dynamics tonight. Thanks for having me.
Yes, ma'am. Yes, ma'am, Dr. Pat.
We blessed to have you.
Thank you.
So I'm Betty Everett, Dr. Betty Everett, and I'm also a psychologist, and I've been around about as many minutes as Pat has. We both have done a lot of work in the field of traumatic stress, working with individuals and groups and community, and Pat's done really probably more community work than I have with this topic, but we just want to kind of put it out there on the table and see what people have to say and what they think, and learn a little bit more about the impact it can have on you, both physically, emotionally, or mentally, and even spiritually.
Right.
So it's a mind, body, soul, spirit kind of impact.
Yeah.
That's amazing. Dr. Betty and Dr. Pat. We're so inspired and grateful that you ladies would take time out of your busy schedules to come and talk to EME about traumatic stress and what it does to people's health and their bodies, and what it does to their mind, and what it does to their family and generational stress. So we're gonna get right down to the get down. That's what we're gonna do right now. I have a question, Dr. Betty and Dr. Pat.
You go.
Do you ladies think that post-traumatic stress syndrome is like a real thing, or is it something made up? Is it diagnosed? Is it like something that doctors say that you literally have that and you need to get medication for it?
I think that's a good start out. And yes, it is a real condition. It is a diagnosable condition. It's recognized in the manual that we use to make diagnosis for clinical purposes. But yes, it definitely is a clinical diagnostic problem. And it can vary from mild to moderate to severe. And the good thing is that there is treatment and not just medication. There are some other effective interventions in addition to medication. And Betty, you may want to share some of the interventions that you use at the trauma center, and I can join in later.
Sure. So I just want to add that there's an international coding system as well as kind of a diagnostic code that is used in the United States, and it's recognized internationally as a medical diagnosis. one of the things that the international system has done that I think was a really important piece of it is included something called complex trauma. And complex trauma adds pieces that have impacted your development if the abuse started pretty early or it was pretty repetitious in some ways. And so what they include are, so post-traumatic stress has problems with hyperarousal, and there are changes in the brain that are connected to that. There's the problem with re-experiencing and memory. And so when you're triggered with PTSD, the part of your brain that's active believes it's happening right now. So it really is a re-experiencing flashback kind of experience. It's not like you're making it up. It's like your brain has shifted and it's like it's happening right now. There's also a lot of a tendency to avoid. And if I thought something was going to trigger me and make my brain go, into re-experiencing, I'd avoid it too. But that can get to be a problem because you wind up avoiding your life.
Right.
And in addition to those symptoms, individuals can develop what is called hypervigilance,
Right.
where their arousal system overreacts to just ordinary noises or events or familiarity to something that they have experienced in the past can cause them to overreact. And it is a physiological reaction based upon the changes that actually occur in the neural pathway in the brain, as well as a psychological emotional response.
Yeah.
So you mean overreact? Like if I'm in a situation where I'm having an argument with someone and it's not even a major argument, but me going through PTSD, I might evaluate it as being more aggressive, and it might turn more physical or turn more violent.
Yes, a person can overreact to loud noises or the content of a conversation. They may misinterpret a conversation, and they can go from 0 to 10 in a matter of seconds. And the response sometimes may be verbal, may be physical, or the person may actually withdraw.
Right. Wow. I think I experienced that. A couple times.
Now, the other thing that gets added with the developmental or the complex PTSD picture is there's patterns of impact on your self-esteem and how you think about yourself. There's impact on your ability to regulate your emotions and your responses. And there's patterns of interpersonal or relationships that get problematic. So those are all pieces of a complex PTSD picture.
Low self-esteem, things like that. Low self-esteem, problems dealing with a crowd of people, things of that nature.
Yes, all of that can be a part of it. And there's a tendency sometimes to isolate.
Right.
Sometimes individuals have difficulty functioning on a job. Because they may misperceive situations, overreact, overrespond, and can go off in a matter of seconds and not realize that they have basically lost control. That's the response to the over arousal within their physiology.
Yeah. Right. So Paul's trying to tell us something.
Yeah, I was just saying, so how would someone get PTSD?
Oh, how would you get PTSD?
Right. Good question.
Well, you know what? We have this little ACEs test that some of us here took, and you can go online and Google what's my ACEs and find this test yourself.
Okay.
But essentially, it comes from having traumatic experiences that are more than your system can take. And the younger you are when you experience those traumatic experiences, the less your system's ready to take. So it can develop in very young kids as well as grown-ups, okay? So physical abuse, sexual abuse, neglect, being bullied, there are a lot of things that people call like capital T, and I'm not crazy about this, nosology, but you know, capital T are really significant things happening to you, but a whole bunch of little T's, like maybe your folks argued a lot, or maybe one of them drank, and then there was violence. So the violence in the home, the interpersonal violence, can really have an impact on your physiology, on your body and your mind, as well as your emotions.
And the trauma can result from observing
Uh-huh.
an experience. It may be a young child in the home who witnesses abuse of a parent or abuse of another child.
Mhm.
Or it may even be in more serious situations, witnessing someone who has been shot or murdered. I've seen a number of patients in my clinic who have actually witnessed the trauma of having seen someone shot or murdered, or maybe had been shot themselves and recovered, and they still relive that event. They have flashbacks of that event.
So just parents arguing in the home, just arguing, no physical, just verbal going back and
Verbal
forth.
abuse, yes.
Can damage your children on
Oh,
that
yeah.
kind of scale. Wow.
Right. You can have verbal abuse as well as physical abuse. And verbal abuse can be just as impactful on young children, young developing children, because their environment is threatened. They don't see this environment as being safe. And then, of course, it's very painful to see a mother abused verbally or physically by a parent or a boyfriend.
Yeah, so it adds up. You know, if you have it repeatedly or over time in your childhood, that has an impact that is really kind of additive in terms of how much it affects your system, your body, your physical health,
Right.
as well as your emotional well-being.
And I know we're going to speak about those protective factors later on.
Yes,
But there are some protective factors, some positive childhood experiences that can mitigate or lessen the impact of traumatic events.
right.
And it may be a grandparent who is aware of what has happened. And a lot of times grandparents can provide those protective factors for young children growing up. Or it may be the church. The church sometimes can be a safe place. Of course, we know that trauma can also happen in the church.
Right.
Because there can be victimization,
Right.
trauma that originates in the church. No place is actually safe. It can happen even in a physician's office. But there are protective factors that can mitigate the impact of trauma in the home. And this can be in communities, churches, extended families, sometimes even teachers can provide those protective factors for children.
So what like for a child that's going through trauma, I know like they pretty much not gonna tell what's really going on, because most trouble come from people you love starting out, and then you kind of be like born into it. So you feel like that whoever doing it or whatever doing it, you feel more like, you know what I'm saying, it's supposed to be going on. Like you know, ain't nothing wrong.
Right.
You know what I'm
That's
saying?
what
So
you think life is.
yeah. So, you know,
Yeah.
when I was growing up, you know what I'm saying, like the counselors and stuff, like in elementary or whatever, I was coached to like never tell them nothing. You know what I'm saying? Like don't like scan or whatever, don't talk to scan, and don't do this and don't do that. So, you know, like what's some of the steps y'all do to the younger youth, or y'all say to the younger youth just to get them to open up and just talk to y'all to get it started? Because I mean, a lot of it be too late. By the time we be in the court system, by the time we can get to y'all, you know what I'm saying, and really and tell
Well,
y'all.
first of all, it's never too late. It's never too late.
That was my first response to.
Yes, because I have seen a number of patients in my practice who may be middle-aged and they have held these secrets for years. And I may be the first person that they have disclosed this to, because it's never too late for treatment, and most situations are not hopeless. Most situations are not hopeless. But back to your question in terms of Many families keep these secrets for years. And sometimes it's not until middle age, when as an adult, they are freer to go in and talk about it in a safe place if they share this. But in terms of young children, there are mandated reporters, and we watch for things, teachers and people in the community. And if we see something, it's our responsibility to report it so that the child can be in a safe environment.
Right.
And treatment involves the parent as well as the child, because it's a part of the system that breeds the trauma. And you can't just treat the child to address the problem. The parents also need to be involved in the treatment. And we in Arkansas, and Betty, you may want to share what happens at the treatment that's provided through our best over at the medical center.
Yeah, so I agree with what Pat's saying, and I think today, more than 20 years ago, we have a little bit more openness and willingness to help the kids talk about it. But also, you know, in my early years, I worked at Children's Hospital when we had a psychiatric unit, and I had a lot of kids disclose abuse to me when I was there. And what they wanted was for their environment to get better. It wasn't that they were asking to be removed.
Right.
They wanted everybody to get help. And so what Pat's saying is today, working with kids, we involve the family.
Yeah.
Right.
And if they happen to be in foster care, we work with foster care. But if the biological parents or the parents who raised the kid also want to be in treatment, they can as well. So a lot of times those parents have had their own traumatic stressors that they've never talked about or dealt with. And so they need help and support as well.
Right.
So it's helping people learn about what PTSD is, you know, what's traumatic stress, and skills to cope with it.
Right. So basically what you're just saying, like if a parent doesn't get this stuff taken care of, and like, say for instance, I'm gonna use myself, if I had this stuff going on in my life, what's it? Am I saying it? PTSD? PTSD.
Yeah.
And I never got
Stress disorder.
having children, it can affect my child.
Yes.
I take it out on my child too if I never get it done.
Right, because it's generational. It is generational. We look at collective trauma as well as generational trauma. And usually trauma is not just a single traumatic experience. It's multiple. And there's certain systems, there's certain conditions that can increase the risk factors. No one is immune. Some of the information that you may have read, you found out that the ACEs test was actually developed on a white middle class group. However, we know that there are certain groups that are more predisposed toward trauma than others, but no one is immune. And we see that particularly in Black and Brown communities. We've seen evidence of that here recently with COVID in terms of systemic effects on the family. And that can play out in reacting to stress in an unhealthy kind of way. Because systemic oppression is still a part of our lived experiences here in America, particularly for Black and Brown individuals.
Yeah, and Dr. Pat, I did a little research and found and about the ACEs that it's not only generational, but it goes into your DNA. It changes your body structure. That severe stress and trauma changes the way your body is made up. So could you elaborate more on that?
Yes, and there are in terms of the MRI, when you look at the structure of your brain through the MRI, trauma can be registered through diagnostic test to see how the neural pathway is affected. But the good thing is that there is something called plasticity, and that is the resilience of the brain, such that interventions can help to reroute that unhealthy neural pathway to restore it to a more functional type of system biologically. But it has an effect on the entire body, including the brain. And there's some research being done at the medical school. Betty, you may want to share. Betty's at the medical school, and they were doing some research with adolescents a few years ago on an intervention that can change the results on the MRI based upon that intervention. Trauma treatment.
Now, if you're a person who had a post-traumatic stress or whatever, you have a child. So when the child born, that make the child like be like hyper or whatever. What they be talking about, like, you know what I'm saying? When your kids go to school, they be hyper and
Well, it's possible that what we were talking about a little bit is called epigenetics. And that means that you have a certain genetic profile, but how that's actually expressed can depend a little bit on the environment. So it can turn on or off different parts of the genes. So what you're talking about is if you have a child and it has PTSD, let's say, for instance, you've had a lot of treatment and you can handle it.
Right.
And when you get a flashback, you're able to kind of calm yourself down and come back to present time. The child is not you're not traumatizing the child then because you've done your work. So that doesn't mean it's going to translate that way. So it's a good reason to do your work.
right.
Right.
You
So
know?
mostly they do a lot of just counseling, medicine. How do you know when medicine need to be involved? Like,
Well, Pat and I are not psychiatrists, but there are medicines that are used that kind of are some of the same medicines that we use for depression or anxiety.
right.
So, those help.
And they do have a medication that's used for flashbacks. It's a recently developed medication, and it is very helpful with patients who suffer with flashbacks when they are awakened in the middle of the night. The dreams are so vivid, it's as if it's happening in their sleep. And there is a medication that can be prescribed by a psychiatrist to help to control that. And many times in working with adults, I work primarily with adults. I don't work with children. I did years ago, but I work with adults now. I also partner with a psychiatrist, and we work in tandem together for the treatment of this. We work as a team to treat the patient. The psychiatrist sees the patient for the medication, and we, of course, communicate in order to provide a comprehensive treatment for the patient. I do the therapy and the psychiatrist prescribes the medication.
I always wanted to know what the difference was. I didn't know what the difference was between a psychologist and a psychiatrist. And you just explained it to me. Thank you.
Well, the psychiatrist has the medical degree and they are trained to prescribe. Of course, in some states, psychologists can prescribe, but they're trained to do that. But the psychiatrist has the MD and the psychologist has the PhD or PsyD or one of those Ds.
So I want to go back to your question just a minute, because if you are a parent and you're able to really bond with your child, to let them know that you love them and that you're there for them and you protect them, not that you do it perfectly, because none of us do it perfectly, that child is going to be a healthy child. Okay.
Yes.
So, in a lot of areas of our life, the relationship is a very key component to things going well.
Right.
So if a parent, they know that you love them and you're there for them, and they need rules, they need structure, but they really need to know that you're there consistently and really listening to them and caring about them. And that goes a long way with a child. And with us adults too.
I was wanting to ask you because when I came in contact and research with PTSD, I came in contact with it being more of a military disease. That's what I heard more of it about because when you guys
And
talk about flashback, that's what they have in the military after they come back from wars. They have those violent flashbacks of interacting with people and taking lives or seeing people's lives taken, and it caused them so much trauma that it altered their way of thinking. I saw a couple of movies like Dead President and other movies showed how black veterans came back and they were totally different people than when they left.
yeah, and that's kind of where the PTSD diagnosis got started. And so a lot of people have that conception, oh, that means you were in the military and that's how you get PTSD. But we know, and not soon thereafter, we actually started diagnosing women with domestic violence, you know, in the 70s and 80s when we were doing the women's movement kind of thing. And around the 80s is we started diagnosing it in children and adolescents, and then, you know, adults who have had significant traumas in their life. So it's the same disorder, it's the same symptoms, they're just coming from different stressors.
Stretchers, right.
And they may have happened earlier in their development, which means it's kind of altered the course of development to some extent.
And as a part of the PTSD syndrome, I think we also need to recognize that PTSD can develop from the effects of racism. Even with what has been going on since May 25th, 2020 with the George Floyd murder and the increased violence against African Americans by police officers. This has been traumatic for our communities. And parents of African American males and females are hyper vigilant when their children go out alone, being very careful and cautious. One of my mentors, who is the late Dr. Robert L. Williams, authored a book entitled Raising Black Kids to Be Okay. And it's an excellent book. If you all have children, I would highly recommend that book. And one of the chapters in the book is instructing parents what to do if their teenager is stopped by a police officer. And this was a few years before what we see now in terms of the trauma that African Americans are subjected to as a result of racism. So there are symptoms of PTSD based upon that vicarious trauma or based upon family members who have been a victim of police brutality that can also lead to symptoms of PTSD.
I understand. I get that.
Yeah, I can see it.
Yeah.
Because I was doing a little research. Again, I love research. I'm like a junkie for that. And I was trying to connect PTSD to our community, and it went back so far, like it's like hundreds of years. I was like, wow. And it's like you never get over it because it's like in your DNA. It's in every generation. Every generation has been through something so traumatic that it's altered our brainwaves. It's horrific. It's like a horror movie if you think about it, because every generation is going through something so tragic, so traumatic that it just tore your brain cells up that you just acted a totally different way than what you would normally act. And that's
part of the
sad.
complex trauma. That's part of the complex traumatic schema that some groups are more susceptible to than others because of the history and what is occurring in our society that we're continuing to have to live through.
Right.
And I don't want to take anything away from what you're talking about because I'm in full agreement with it. And I want us to keep remembering that we have treatments that work.
Right.
We have treatments that work.
Right.
We've got good research on it. You get in a good therapeutic relationship with someone and you can change the chemistry of your brain, like Pat was talking about with the fMRI, the MRI studies of the brain.
Right.
You know, the trauma changes the genetics, it changes the structure of the brain, you know, it changes your response to stressors like inflammation. You know, we haven't talked a lot about the physical effects on the body, but things can go back.
Right. I just
And
wanted
in cases where healing, oh, I'm sorry, go on. I didn't mean to interrupt.
no, I was just gonna say, I was just going off what Charlie Mack was saying. You know, I was even looking at these tests you gave us, and it says before your 18th birthday. So, you know, I was just thinking about not only myself, but how many of my associates in the community have been through trauma, and they want it's that's why it's so much. You know, a lot of people never sat down and looked at this and never took this test. A lot of people never dealt with this type of stuff, so therefore they acting out their trauma in that type of way. And that's why it's like it's so much chaos out there, because there's so many people been traumatized, but they never talked to a counselor. They never talked to nobody about it. So they're just out there acting, like he said, not in the way they normally should be acting. They acting out of hurt. They acting out of all this type of stuff that's happening to them that they never dealt with. So that's why so much violence and stuff in the city, going back to what we're trying to help. So this is very good to get this help for ourselves, that we can go out there and help other people, because it's a lot of people.
And I think you all have a very powerful voice in the community. For years, we had natural therapists. I call them natural therapists in the African American community. They may not have even finished high school, didn't have a college degree, but they had a natural way of working with their family members to teach them coping mechanisms, how to regulate your emotions, how to feel good about themselves. I think most of us know the story of Maya Angelou, who was victimized, and she was mute for a number of years. And it was one of the teachers in her community who established a relationship with her. She would have her over in her home, and Maya wouldn't speak, but this teacher was engaging. She affirmed her. She loved her. And it was through that relationship. She was a natural therapist. She was a public educator. She was not a trained therapist, but she had a therapeutic impact in her life. And we know that story, and we see how successful she became. Right. So that just shows you how interventions, that's just one example of many, how that an intervention that has to do with the relationship between that natural therapist or that professional therapist and that child can make a difference that can have a lasting impact.
Right. Because some people, like, I was even thinking about how, you know, we was talking about how the parents argue and abuse in the home, and it's so many kids grow up and see that nowadays, and then it's so much violence in the Black community, so much violence, but that's because, you know, we grew up seeing it in our home, all that fighting and drama, seeing it as a little kid, that's trauma. Like, but we don't look at it like that. Like we were saying, we look at it like that's regular. It's just how it's supposed to be. Like, we supposed to fight, we supposed to hit, but we really don't supposed to do that. You don't really have to be like that, but that's what we've seen our whole lives. And when you see that as a young age, and it become normal, but it's not normal. And it's not.
Right.
I mean, when you're traumatized people, things like they happen, because we, as in our community, I mean, for our history, we understand that, you know, slavery was first,
Right?
And then when we tried to beat that, you know, the law, the police and the law, you know, they squeezing us out. You know what I'm saying? So now we done turn the weaponry on each other. You know what I'm saying? And now we fighting each other. You know what I'm saying? Like, it coming in phases. You know what I'm saying? And I just think people should just get more, like you say, more counsel,
right?
And start more talking about it. Like, listening to more podcasts, being active in the community on trying to get people to express themselves with trauma, because trauma a very tricky situation. Like, we don't like talking about it because we always talk to dodge that.
Right.
You know what I'm saying? Or to accept what go on. You know what I'm saying? Like, it's in the past. Okay, boom, that ain't what you living now or something. But we don't know that be eating you up. That be, it's like it's in your DNA. You know what I'm saying? Like, you know, like even with my dad, like in my world, like, still, you know, my dad used to take stuff. So So, and then when I grew up, you know what I'm saying, when I was a baby, I was taking things and nobody told me it was wrong. So I used to tend to just run in stuff, rob and stuff and all that. And I didn't think nothing was wrong with it. You know what I'm saying? So
Right.
maybe
That had been modeled. That had been modeled to you, and that's why children who grow up in abusive households are at a higher risk of becoming abusive parents. And that's why we are concerned about breaking that cycle, about intervening with families to show another way of parenting.
Right.
I patch it up with your family. Just start patching things up. Like we had to patch it up what I did. We got a great relationship with what I did now, but
Right.
you know what I'm saying?
Wonderful.
We went through a lot, you know what I'm saying? But then I had to go back there. He went through some too. You know what I'm saying? Like
Right. That's part of that generational trauma. It's passed down from generation to generation.
Right. You know, I think counseling and trauma counseling need to be active as far as they need to get control of elementary, get younger, like start getting in it, because that's when it started, when you're little, you know what I'm saying? People don't know that, and then we don't say nothing because we used to it, because it's coming from the people we love, so we live it. You know what I mean? So I don't know. I mean, trauma just hard.
Right.
It's a hard touchy
It's
subject.
difficult. It's a reality and it's difficult. And there are opportunities to access care for more groups now. Even if a person doesn't have insurance, there is a grant money that's been provided at UAMS that provides opportunities for individuals to get treatment, even if they don't have the money to pay or insurance that covers. Betty, you may be able to share more about the program at UAMS.
Yeah, so what's Pat's talking about is a program called R Connect, AR Connect. And we actually were able to start that program at UAMS with some money from COVID to help care for people. And so it's a 24/7 line that anyone in Arkansas can call and say, I need help with X, Y, Z. And they will do some of the therapy, either in person or mostly telemedicine, and they will help connect them with local providers to follow up after that.
That's good.
And then, you know, UAMS has always had a policy that if you're low income, you can qualify for a hospital discount. And unfortunately, they don't advertise that as much as I think they ought to. But you can, you know, go through the hospital discount program and get some care that way.
Right. And I'm glad
And we have programs at the Child Study Center that starts with infants, goes on up to like 4 or 5 year old. And then as they get older, we have trauma focus, cognitive behavioral therapy. We have EMDR provided for the kids and the adolescents. And then we have adult clinics that are now very well trauma trained. You know, that's been an emphasis for the last couple of years to help get more of our people trained to really treat trauma and treat it well.
And the program at UAMS provides training for counselors throughout the state.
Right.
And it's very intense training that's provided. And they have to go through a period of supervision, working under individuals who have expertise in this area. So it's not just in Pulaski County, it's throughout the state. And there is a directory of those individuals, those counselors who have gone through this training so that they can be identified even out in rural areas where you don't have access to mental health care like we have in Pulaski County.
And that's cited ARBEST, ARBEST.
Like, I know people that doing trauma that kind of like be getting in trouble in the courts or whatever, are the judges and stuff starting to respect people more on the trauma area, like starting to see the person like they might be.
I think we've got work to do.
Yeah.
I think we've got work to do to help the judges and the attorneys be more trauma-informed care.
Yeah.
But I think, you know, Restore Hope's making inroads into that.
Right.
And I think, you know, other attorneys and lawyers and judges are attending to that as well.
So it's starting to grow.
I'm
Right.
Growth.
I'm
Yes.
glad
I
you
think that's an excellent question because that has to do with changing the system. Now, the work that we do is one-on-one, but we know that there are systems that impact families as well. And the judicial system has a big impact on families. And sometimes it can be part of that oppressive system. I know that there are some judges who are working with substance abuse issues, and they will work with treatment programs for providing counseling for individuals who may have an addiction problem, and they will help to reduce their sentence or whatever based upon getting into a rehab program. So I think that's another area, like Betty said, that we need to have an impact on, and that is the judicial system and dealing with trauma, particularly in the juvenile justice system with children.
I know a judge, Judge Marion Humphrey. He does a lot of work. Judge Marion Humphrey out of Little Rock. He does a lot of work with the young people. He's an
retired
judge.
now, though. He's retired now.
But when he was a judge, he helped me. He helped me big time. He helped a lot of brothers that was out there in the streets, give them another chance and giving them another opportunity to make their life better. So I'll give him a shout out and a salute to retired Judge Marion Humphrey.
Yes, I'm glad you mentioned that because he and others as well are helping to give individuals a second chance, and it makes a difference, not only for that individual, but also for their families. And he's still doing good work, Charlie Mack. He's still doing good work in the community. He's not
I follow him. I follow him on Facebook. I follow him. He's a reverend. He's a pastor at a church too.
That's right. He's a Presbyterian pastor, and he also has a law practice.
Yeah, I follow Mr. Humphrey. He's the truth for real. He's a good guy.
All the way from Paris, you're following him.
Yeah, I follow. I'm from Little Rock, but I keep my eyes on my town, so I know what's going on when people don't think I know. I know what's going on in the city.
Great. The other thing that's not all people don't always know to ask for or to get, if you have a child that's in the court system, they can have a guardian ad litem. And the guardian ad litem's job is to really protect the best interests of the child. So dad might have an attorney or mom might have an attorney, but this is a court appointed person to take care of the child.
You said the name is that what?
A guardian ad litem.
A guardian ad litem. So they're just.
I never heard of that.
Just a special, like a special angel for the child.
Exactly.
Like they hold it, and no matter what, they gotta be for the best interest.
Best interest of the child.
Well, I was just gonna say I'm glad you brought that up about the doing it with the system, because a lot of like I was saying, that's a lot of the younger people's problem is they've been trauma, and when you just like doing a person on drugs, if you just throw them in there on drugs and they never get no help with that drug, they're gonna get out and get back on drugs. They're gonna continue to do it.
Exactly.
That's why a repeated cycle of young teens acting up once they get out. Like, what's wrong with them? Why won't they get it right? But that's trauma. It's a lot of stuff going on, but like I say, it don't get talked about. It gets swept under the rug because I'm a victim to it. I say it boldly on this tape because I'm gonna write a book. Everything on this paper I've been through, and I act a fool as a young age. I mean, a plump fool, was going crazy, but I didn't know. I didn't know what I had. I never even talked to my family about what happened to me till I was 19 years old. So to go through all that and just to see me and see so many others, that because the leader I am in the community, how many young men talk to me one-on-one and like, Lord, it's so many people I've been through so much stuff, but they never get deal with it, and that's why they get in so much trouble. Whether that's through violence, through alcohol, through gun violence, that's how they deal with it. And locking them up is really not nothing because if they don't get the help. Now, there's a lot of programs behind bars, especially in the prison system, I know. But I know when I was in juvenile, it wasn't. They just put us in there and let us right back out.
Yeah.
And I kept getting in trouble. And that led me down the line to prison.
Yeah. So one of the key questions with trauma-informed care, and you may have heard this quote from Oprah, instead of saying what's wrong with this person, What happened?
Yeah, what happened? Right,
Mhm.
right. That is
What
so
happened?
true. What happened to
Yeah,
me?
What
that's
happened?
in
That's not normal. Like,
Uh-huh.
what
that's
happened?
in
What
that's in
happened?
a lot of
And this is a list of some things that might have happened.
Right,
This agent
Right, for
has
real.
here.
our
Yeah.
people need second chances when it comes to trauma.
right. They
So
do.
we've been through a lot out here. We're going through a lot right now.
Yeah,
You
right.
know what I'm saying? Like, man, people won't believe the stuff that some of these grown people, children, everything going through when it comes to poverty, come to being scared. You know what I'm saying? And nobody to talk to, don't know who to talk to. And I just want my
Yeah.
thing in this podcast and just really to be a voice and
Yeah.
Right.
and let people know, they can reach out to us, man, Restore Hope, and us, man, and we can find them to help. You know what I'm
Right.
saying?
Right. And
And
it's
point them in the right direction.
exactly. And it's okay to acknowledge that. It's okay to say that I'm not okay. And that's something that all of us have had to admit over the past year and a half with COVID. COVID has impacted everybody, and we're not okay. We are not okay. Sadly, some individuals are in denial. But when we are in denial, that creates a higher risk factor for situations becoming worse. There's been a lot of trauma associated with what we've been living through with this virus. Domestic violence has gone up, and children are suffering from emotional distress. It has been traumatic. One of my friends was telling me about a situation where her child was in a family setting and someone wasn't wearing a mask, and the child was afraid that this person was going to die because they didn't have the mask on and they were going to catch COVID, and just had a meltdown. So this situation that we're living through has been traumatizing as well, added to what was already there, the pre-existing situation.
Yeah.
Right. And a lot of people just, stressed financially and a lot of stuff. And then the kids having to see that, wondering where the next meal going to come from money wise, losing things. Like, yeah, I can see a lot of people.
Right. Afraid of being evicted.
I seen a lot of men in COVID like mad at their baby mamas, mad at their wives and stuff because they had got more money than the man.
Somebody killed.
You know what I'm saying? And they didn't take that lightly. You know what I'm saying? They like, dang, you get this kind of money and we ain't getting this. And then the woman went share it with them or something. And man, it just started a whole big old mess. You know what I'm saying? He ended up hurting the lady and all that.
Yeah, one
You know
guy
what I'm
killed
saying?
somebody.
So
killed his
it's a
baby.
lot of stuff going on with this COVID stuff, man. It's hard
Exactly.
to cope.
Right.
And it's not understanding why they got to wear a mask all day. So it's kind of like, our kids, they run around. You know what I'm saying? We don't live like got our kids quiet or teach them to hold something on their face for that amount of time. You know what I'm saying? That irritate them. Like they don't understand. Like they want it off their face. You know what I'm saying? And we instead of saying we need to get the mask on the children too. You know what I'm saying? But it'd be kind of hard as a parent trying to co-parent and raise the kids to adapt to COVID. You know what I'm saying? COVID is real out here with that,
Right. It's been traumatic. That's another contemporary traumatic situation that we are living through still.
Do they have classes for that, like to teach people more about COVID and how to be safe during COVID and you know what I'm saying? What we really should be doing in this? Cause
I'm not aware of any classes. I know that certain groups are having Zoom events that get information out to the public about coping and dealing with stress. I'm a member of an organization. I'm a member of two psychological groups. One is the Arkansas Psychological Association, the American Psychological Association, and the Arkansas Association of Black Psychology Professionals. Mm-hmm. The acronyms are AABPP. I would encourage your listening audience to go to our Facebook page and also to our YouTube page. We started a series of town hall meetings in 2020, May 2020. And the series is called Mindful Minute. The first Monday of each month, we had a topic related to navigating the dual pandemics of racism and COVID. And all of the, we recorded everything. We have it on YouTube, and we also have it on Facebook. We had one for teachers. We had one for parents. We had one on navigating the holidays with COVID, how you can still have fun and protect yourself. So that is something that we made available to the community, and you can access that through AABPP, the YouTube page, and also our Facebook page. One of our members who is in at one of the universities did a pre-recorded event on the psychology, what the psychologists are saying about COVID and the vaccine. Well, many times the community is not really interested in hearing the voice of an academician. So we have decided to pair that presentation with the voice of community leaders. And on August the 30th, we will be airing a town hall meeting on the voice of the community combined with the voice of the scientists on the benefits of the vaccine. Because we know that the community leaders have a powerful voice within the Black community, just like the voices that you have. You have a very powerful voice.
Thank you.
Yeah, we community leaders, life coaches, created by.
Yes, you're community leaders.
I have a question. What does the with this test? What does this test scores mean?
So, Paul is almost a better expert at this than I am. But the ACEs are Adverse Childhood Event Scale. Again, you can find a copy of it online to take. It started in a medical facility, like Dr. Pat said earlier, because they were having physical health problems. And what they found was people who had high ACEs had a lot more problems with their physical health. They had problems with heart disease. They had problems with autoimmune diseases. They had problems with their lungs. They had problems with blood sugar. They had problems with obesity. They just had a lot more physical health issues, as well as more risk for anxiety and depression and PTSD. But they were initially looking at the physical effects of it. And so the higher the score, the higher the risk. The higher the score, the higher the risk.
If you score, if everything was, I get what you're saying. I don't even got to.
So there are 10 questions.
Yeah,
If you've got a score of 3, that means that traumatic stress has had a significant impact on your physical health as well as your mental health.
Right.
If you've got a score of 6, the statistics are you're going to die 20 years younger than someone without that history. Okay, so you're more likely to just have more and more physical health issues like diabetes, heart disease, and
diabetes. Yeah, I mean
diabetes, high blood pressure, cardiac problems, and again, early intervention is important.
Right.
You can lengthen your life expectancy even without having these conditions due to the risk of a traumatic life experience. Because a lot of times individuals who are born with a silver spoon in their mouths can sometimes be predisposed toward these conditions. But treatment, early intervention is the key. And it's never too late, never too late.
And positive factors, there's a balance between the stress and the positive factors and kind of how resilient you are.
Right.
So positive protective factors are things like a good relationship with someone.
Right.
Even one person that believes in you and cares about you and supports you can make a significant difference in how your life looks.
Right.
One person really supporting you and connecting with you.
That person is the Lord.
And that brings another factor. I'm glad you mentioned that. And that is spirituality.
Right.
Spirituality has been researched. As a matter of fact, at the University of Pennsylvania, they have a research center that is conducting research on spirituality as a mitigating factor for stress. And one of the topics that we presented through this town hall meeting covered the impact of spirituality on one's mental health. And we had a psychiatrist as a spokesperson who is also involved in her church, Dr. Annette Slater. She's still an active psychiatrist, although she's retired. And we had a medical doctor who is also a minister, Dr. Harold Benton. Some of you may have heard of Dr. Benton. Well, they were our guests in April, and they covered the science of spirituality and the impact that it can have on one's mental health. So spirituality, I'm glad you mentioned that. Meditation is a type of contemplative spiritual experience that can bring about a common effect in the brain. And individuals who meditate, who pray, who are even into communal spiritual experiences, those have been powerful mitigating factors in the Black community. The church has been a haven for families and individuals. So I'm glad you mentioned that, because that is very important. That can be very important in the lives of individuals and families.
Yeah, I used a lot of that, and to help me cope with my traumas, what I went through when I was young. Because I was violent. I tend to get in trouble. I fought a lot. You know what I'm saying? But I had a lot of love because I had a woman. I had a grandma. She lived to be 98. You know what I mean? And it was just a bundle of love. You know what I'm saying? So I always had that. You know what I'm saying? That was my life.
You knew you were loved.
Yeah.
You knew you were loved.
I needed it, you know what I'm saying? I fed off of it. I search for it now, you know what I'm saying? Like, because I know what it feels like. And a lot of people in our community don't know what love feels like. So that's why they violence tend to be more heavier than mine was. But I just clung on, like you right about find somebody that believe in you and find the love and the positive. Because you gotta find those things before you mess up, you know what I'm saying? And so that's love is important, you know what I'm saying?
Very important. Very important.
It's real.
I remember growing up, I'm a product of the Baptist church. And I remember some churches would have a motto and they would put it on their church bulletin. And one of the churches, it may have been one of the churches in our community, one of their mottos was, this is a church where everybody is somebody, elevating the self-esteem of the individuals in that community. Those workers in the church who nurtured those little children when they would have those Christmas programs, those Easter programs, and would help them to get up and perform even when they were afraid to. That's a mitigating factor. That's a positive childhood experience that can mitigate some of the pain that they may have been experiencing.
Yeah, I agree.
I just think get a lot of more programs and stuff can help with it, and with kids and adults with just get active. You know what I'm saying?
Let's get active,
especially in these communities. You know what I'm saying? Keep them something for them to do. Keep their minds wandering. Keep them educated. You know what I'm saying? Because ain't nothing wrong with learning. You know what I mean? And learning get fun too. You know what I'm saying? When somebody teaches you, or when you're doing it, somebody like our brand and our company is, it's based on experience and us learning each other. The more we do this, the more we learn each other as friends. The more we learn it, you know what I'm saying? We just bonding through all of this. So a lot of people need to just get together and maybe get them a company or something, or get with some people and start. You know what I'm saying? Learning how to be civilized people again and helping each other.
Well, and knowing what your values are and living a life that's attuned or aligned with, that expresses those values is a really important part of coping with this too.
Right. Knowing you have purpose in life.
Right.
Because if you feel like you don't have no purpose in life, you're not gonna live for nothing. You ain't gonna have no values or nothing.
Right.
Finding a purpose of life and sticking to it. Like all it
Makes a
ties
big
up
difference.
spirituality,
Mhm.
physical, mentally, it all run together. You need it all to function right in this world. You need it
Yeah.
all.
Yeah.
And I'm glad you said spirituality and not just religion, because some people might not be in church. They might be a Buddhist. They might be a Muslim, but they need.
Exactly. Right.
Right.
It ain't a right or wrong. I know when I was
Right.
deep in the church, I always pointed the finger, but no, hey, whatever worked for you. God loves us all. That's the one, man. Now, like people, because it's a lot going on out there. People need help.
Exactly. God is the God of diversity.
Right.
God is the God of diversity.
Need more
But
Trump.
I want to play the devil's advocate because we've been talking about how individuals can, get counseling and get help get themselves right, talk to somebody about it. But we haven't. There's an elephant in the room, and that's the systems that keep becoming stronger and becoming financially engulfing on the individual. There's systems that keep portraying and letting these traumatic experiences. They're not helping with this. Now, individuals can help themselves. That's true. But when there are so many strong systems that are constantly elevating and pushing this trauma, what do we do about that?
That's an excellent question. And that is a timeless question because this is something that we have been dealing with forever. Each person has a role that they can play in terms of creating a healthy environment. Some are called to be counselors, therapists, medical professionals, and then some are called for advocacy. And my hat goes off to individuals who get out there in the community and challenge the political system. There's a role and there's a place for those individuals. And we see evidence of that because there are some policies. We work with the individuals. We work with smaller systems. Betty and I work with families, individuals, but then there is a place for advocacy work. We do advocacy work as psychologists now because we have, I don't want to get off track, but we go on Capitol Hill and yearly on a regular basis, we have an advocacy component nationally, and we also have an advocacy committee here in Arkansas with the Arkansas Psychological Association. And these are individuals who actually work on policy changes from the legislative area. And there is a need for that as well as working with individuals through counseling or therapy. That's another system that psychologists and community leaders can have a big impact.
Yeah, that's close to my heart. Policy changes. These policy changes are bigger than the individual. They always engulf and swallow up the little guy. So we have to also attack these big businesses and policies because they're going to keep making money off this trauma. They're making money off of trauma. That's literally what they're doing.
There is a lot of money made off of the judicial system, the criminal justice system.
Yes, all of them. Yeah.
Yes, right.
Well, we got to stop black on black crime too, though. You know what I'm saying? More than it, like, to first of all, to even put our feet in the door. You know what I'm saying? Because right now we actually hurting each other out here on the street. So
Trauma.
yeah, so we got to
That's the
take this
problem.
trauma, like I say, and start back loving on each other as a unit, and then we can start voting and doing what we need to do to get people in position to where we need them to be. Everybody got to start playing their role.
Right.
You know what I'm saying? And actually physically doing something and caring about each other. You know what I'm saying? Just get back with each other, man.
Right. And there's a role that everybody can play. Everybody can do something. Everybody can do something.
But community engagement, policy changes, working, with the legislatures. There are a lot of different levels to work on these issues. And as Pat said, we each have our role.
Right.
And, I often have to kind of stop and think sometimes during the day and know that I believe that each person doing what they believe is the right thing has an impact.
Right.
And the more of us who do that, the more we've got a group effort.
Right. Well, I just want to personally say, you know, I had no idea, but I was getting myself in today with you two ladies being here. But this is one of the best podcasts is that, and we've been doing this for a while. I have had, because at the end of the day, it's something about today that's so different, so much order, so much knowledge has been given. Because even the field that I'm going in, like this is it. Even taking this test and being truthful with these answers, man, it made me not only see myself, but made me see so many of my brothers out there in the community that I know that I gotta help, man. And this is the problem. This is stuff that we don't look at. And it's stuff they're not gonna talk about, and it's stuff that somebody gotta stand up and gotta say, I've been through it, and I'm just like you, and we can get through this. It gotta be talked about. It can't be swept under the rug no more. If we want the crime rate to drop, we got to deal with these people that have been trauma. That's a lot, but a lot of people don't want to put that title on it, but that's what it is.
So I want to. I know that. I guess it's a podcast people can see or people can hear, or is it both?
They can do both.
Both. So if you think about your brain, like my wrist, my hand is my brain. Okay, there's a part of the brain that's pretty kind of the first part of the brain we think that maybe develops, and it's a more primitive brain, and it's a more automatic brain. That's where the adrenaline comes from, and that's part of the system that has to do with the traumatic stress response. Okay, and then there's a part of the brain that's involved in the feeling and the thinking, and it's kind of in the middle. And then this part is like our thinking brain. Okay, so when somebody gets triggered, something happens that they're getting a flashback or they're re-experiencing something, what happens is this thinking part of their brain goes offline, and this more automatic part of the brain and the thinking brain don't connect.
Right.
Okay. So anything that helps you get this kind of calmed down, and that can be a relationship with somebody you care about, or being around somebody else that's pretty calm, or breathing, or mindfulness, or exercise, things that kind of help your brain come back where you can think, then it's going to help you get out of that traumatic stress response. Because what the sympathetic nervous system does, which is part of the adrenaline system, okay, if you've got a traumatic stress, the first thing you want to do is fight.
Right.
Well, the first thing you want to do is run. And if you can't run, then you want to fight. Okay. And that's where that anger and all of that comes from. And if you can't run and you can't fight, then you freeze. Okay. Kind of like an opossum plays dead. You know, it's like if I go away, I won't feel it, or maybe they'll leave me alone,
Right.
you know, something like that. And we also talk about a fourth part, and that's where you figure out what you have to do, even as a very young kid, to help try to keep those people who are having problems stay calm.
Right.
So you learn to kind of read other people and do what you think they want you to do to help keep them calm,
Right.
which means it costs you your own sense of self in
right.
some ways.
Right. I know exactly what you
Yeah, yeah. So treatment are things that help you integrate your brain again, so you can think and feel and respond in a way that's calm from your heart.
So, Dr. Pat, do you? I'll ask you a question. Do you believe in the cause and effect theory?
That's a very broad question, Mr. Charlie Mack.
I'm talking about. Okay, let's put it to a certain subject.
All right.
Okay, in the Black community, there have been so many hundreds of years of trauma, right? We just talked about this, right?
Yes, right.
And then we come to a saying, or what people like to call black on black crime. So, do you think there's a cause and effect to black on black crime, so-called black on black crime, through trauma?
Yes, there can be. For sure, there can be. Because, and I think this may be a subject for another podcast, because this can cover, yes, a follow-up perhaps. There is an expression that liberation liberates, oppression oppresses. And this applies not only to black on black crime, it also applies to the psychology of oppression. Individuals who grow up in oppressive systems turn around and can become the most oppressive. Those who have been traumatized usually traumatize others, and that's not just Black on Black. We see this with women. You know, this is another oppressed group, and women in powerful positions can be, and these are not Black women, because many times Black women are not in positions of power, but women who are in positions of power sometimes can be the most oppressive because they have been victims of oppression. So to respond to your question of cause and effect, there is a connection.
Right, that's all I wanted you to touch on.
Yes, individuals who have been victims of oppression, be it racism, be it genderism, be it sexism, whatever the ism is, if they are still trapped in that oppression and they have not liberated themselves through some of the measures that we talked about tonight, then they perpetuate that cycle of the cause and effect of it's the psychology of oppression. And it's not just with racism. I want to expand it beyond racism.
Okay, but I was just touching on the subject because you said it was general. So I just wanted to put a certain subject on it, and then we could, you know, put some singularity to it.
All right. So does that make sense?
Yes, ma'am. It makes total sense.
Liberation liberates, oppression oppresses.
Okay.
Yeah.
And that cycle can be broken. That cycle can be broken. That's the good news. And that's the takeaway that I want your listening audience to hear.
Solutions. We try to come up with solutions to the cycle.
And there's a science to treatment. There's a science to treatment. We have natural therapists, as I mentioned. We have trained therapists, but we have healthy systems within a dysfunctional system that provide those positive experiences in the lives of others. And that gives us—
that makes so much sense. That makes sense what you just said.
That gives us hope.
Say that again. Say that again, Dr. Pat. We have systems inside a dysfunctional system. Say that again.
You said it.
Systems within the dysfunctional system to fix them. Okay. Okay.
We have healthy functional systems even within dysfunctional systems that can make a difference in the lives of individuals.
Right.
That's what we bank on. That's what we were banking on.
God can use it. God can use anybody.
Right.
Yeah, we
see examples of that in the sacred writings, in the ancient scriptures.
Right.
So there is hope.
We just really trying to stop Black on Black crime in our community. That's all. You know what I'm saying? And we want our people to, you know, see the importance in Little Rock, how we need to slow down on this crime out here. You know what I'm saying? Because Little Rock have a lot of crime, a lot of innocent people dying. You know what I'm saying? And
exactly. Yes.
We just trying to get the help for them, stay a voice for them, and lead them the way. Show them where they can go to get help for anything that they need.
And my hat goes off to you. I commend you for the work that you are doing, because you're doing what Betty and I cannot do. Everybody has a place. Everybody has a role. And you're to be commended for your dedication, for your passion, for your call, for your response to the call in the community. And this is living life with purpose. This is definitely purpose-filled life that you're living.
You're the healthy.
Thank you, Dr. Betty.
You bet. Thank y'all. Appreciate being invited.
Yes, thank you. Thank you so much.
I just want to close us out in a word of prayer. If you could you bow your heads, close your eyes. Creator God, we just want to come to you tonight, first and foremost, and say thank you for this night. I pray that something on this podcast was said tonight, God, that will help the hearers that sees this, God, and let them be able to know that God is help out there for them, as well as ourselves, God. I just ask that you just cover your people and lead them in the way that they should go. God, let us get home safely until we meet again. We want to thank you and praise you. It's in your most holy name we pray. Amen.
Amen.
Amen. Thank you, Dr. Betty. Thank you, Dr. Pat, for coming on the show. and showing us love. We want you guys to witness these programs that are in place to help us go through trauma and be in contact. We will have all the information for you. So get out and get the help, because we getting our own help so we can help you guys. It's EME, baby. Woo, woo.